Does it seem like your pet is always hungry no matter how much or what you feed them? Do you find yourself caught in the vicious cycle of fill the water bowl and then letting them outside? Fill the water bowl, get the door. Or are you cleaning out the litter box more than you used to? While it might seem like your little buddy might just be hungry or a little thirstier, these can be classic warning signs of a dangerous but treatable disease, diabetes. Hi, I'm Dr. Tony Kremer from the Oswego Animal Hospital. Diabetes is a serious condition that can not only affect your pet's health, but requires commitment on your part as a responsible pet owner to help maintain and treat the disease. The good news is that diabetes can be managed effectively and might even be preventable in some cases by good preventative care. So before you get too worried, let's talk about what diabetes is. In short, diabetes is a disorder that occurs when the body is unable to regulate blood sugar levels. Blood sugar, or glucose, is used by the body's cells as a source of energy. Even though it's called sugar, this blood sugar isn't the same as the sugar that might be found in your pet's food. Glucose is one result of the process of digestion of the food your pet eats. The glucose resulting from digestion is carried in the bloodstream all over your pet's body, and your pet's cells use the glucose to provide energy for their function and survival. But in order for the cells to use the glucose, there needs to be a way for the glucose to get into the cell. This is accomplished when insulin in the blood attaches itself to receptors on the cells, which lets the glucose in. Think of insulin as the key that unlocks a door. Diabetes can affect your pets in two different ways: by shutting down the source of insulin production in the pancreas. This may be referred to as type 1 diabetes, or by causing your pet cells to develop a resistance to insulin so they don't respond normally to it. Often called type 2 diabetes, this is only found in cats, not dogs. In other words, there's no key, or the key doesn't fit the lock anymore. Now that you know what diabetes is, let's talk about what causes it and some simple ways to prevent it. While we don't know the exact cause of diabetes, we know that certain factors contribute to becoming diabetic. Type 1 diabetes can occur because of genetics. Certain breeds are more susceptible. Or problems with the pancreas that prevent it from producing insulin, and this is the only type of diabetes you will see in dogs. Unfortunately, you can't prevent a dog from getting type 1 diabetes. Treating type 1 diabetes requires regular insulin injections, just like a person with diabetes. It's not as hard as it sounds, and your veterinarian can work with you so that you are confident and competent in giving that injection. On the other hand, one of the most common causes of type 2 diabetes in cats is being overweight. Consistently overeating can cause an excess amount of glucose in the blood for an extended amount of time. Because there is too much glucose for the cells to process, the cells will signal the receptors not to allow glucose in, and this can cause a resistance to insulin. While dogs don't get type 2 diabetes, being overweight can make their diabetes harder to control. The best prevention is through proper diet and exercise. Talk to your veterinarian about designing a program that's right for both you and your pet. And just so you know, insulin resistance can also be triggered by diseases your pet may have had in the past or medication they've taken. The most important thing is making sure that you take your pet to the veterinarian as soon as you see symptoms. Excessive appetite, excessive thirst, excessive urination, and lethargy can all be signs of diabetes. Although a diagnosis of diabetes means a lifestyle change for your pet and you, with the proper treatment and regular checkups with your veterinarian, it is manageable. Sometimes a simple diet modification and an increase in exercise is all that you need. In other instances, insulin and other medications will need to be administered. In either case, your pet will need to be closely monitored. But with the proper care and in collaboration with your veterinarian, you can help your pet live a longer, happier life. For more information on pets and pet health, visit avma.org.